Hello, this is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And my hope for you is that with each passing episode, you get closer to being your own best expert. Today we have Katie Beeson, who is an RN, a lactation consultant specialist, and co-owner of MomSense here in Northwest Indiana and Crown Point. Hi, Katie.
Hi.
We are going to talk about some really normal things, but that, as Katie says, she wants to support families, moms and dads, in doing what's normal. And she said it must be much better than that. But let's dive in. Tell us about you and MomSense and lactation and all that.
Okay. Well, thanks for having me. My name's Katie, and I have been a nurse in women's health for the majority of my career, which is it's been about 14 years as a nurse. And early on, entering the women's health field made me realize that there's a lot of things that are broken in the healthcare, model in general. But
So true.
yes. And so I feel like, every nurse that I've ever met has sort of a journey in how they found their specialty and where they found their space. And I came to finding lactation and supporting people with breastfeeding because I was a OB nurse and charged with helping people to breastfeed. And the majority of the people walking into our hospital wanted to breastfeed, something around 98%. And we were looking at rates of breastfeeding with them leaving the hospital being just dismally low compared to the initiation rate of people wanting to breastfeed. And the majority of the education that most nurses and even people in the healthcare field in general, pediatricians, obstetricians, most of them receive very little breastfeeding support or education.
Why
And
would they?
why? Preventative medicine, nutrition, infant health, who knows, right? But
Knows.
yeah. And so I felt really uncomfortable with the fact that the majority of us were being educated by the formula reps that were coming into the hospital on breastfeeding, right? Like
Like what a conflict.
so bad. So the hospital I was working for at the time actually employed an amazing lactation consultant. And there was a huge education push for the nurses to become what's called baby friendly. It's a certification that hospital can receive for supporting, again, some just normal practices.
Right.
And so that was what led me to want to become a lactation consultant, because it was so interesting to find out how this is just so broken in our country and our culture. And then being a lactation consultant is an IBCLC. It stands for international. So it's an international board certification, and it requires 1,000 clinical hours before you can even sit for your boards. So it's a massive
Wow.
amount of education. And it's really something that is a labor of love. It's expensive, the whole thing. But what was mind boggling is that international piece, you're learning about other cultures and how this is so much more supported. There's so many less barriers to breastfeeding in other parts of the world. And being a lactation consultant in the United States is a very different experience than talking to someone that works in the UK or, in France. So that's really been very eye-opening to me. And a big part of my push with education is, hey, if this is happening and this is normal in other parts of the world, why isn't it normal here? So really just like one day at a time, just kind of trying to help break down those barriers, help educate parents in what the right decision is for them. We call our business MomSense for a reason. We
I
absolutely
love that name.
Yes, we do too. It's that inner knowing, trust your mom sense. We say it all the time here because it's really not just cliche. It's really important to kind of look at what feels right. And, is someone else making this decision for you, or if you're making that decision for your family? So that's kind of MomSense came from, we opened in 2019. We started as just a lactation clinic that also specialized in tongue ties. And that's something that we really had a need for in this area because we were sending people out to Indianapolis or Chicago to do a very simple procedure. And then we were already providing that care afterwards, as far as like that oral rehabilitation. So that's why we started.
Little clarifications or questions of my own. Um, One, let's talk about the tongue tie, which I found just because I see babies in my office. Thankfully, you send me babies to work on. We do cranial work, we do spinal alignments, we do work with their jaw, and more and more over the last probably 10 years, it's been like more and more tongue tie and lip tie releases. And I'm sure many in our audience don't even know what that is. And my question is it more prevalent now, or are we just noticing that the ramifications of leaving that there are large, so we want to deal with that?
Yeah, that's such a good question. We get asked all the time. So, what we know is that eons ago, when people were born in homes and there was a midwife there, the midwives were often known to have one long fingernail to make sure that they checked the under part of the tongue for what's called a frenulum, every baby. Because, of course, yes, we're talking about, during a time when breastfeeding was normal and
That
a
is
baby
so
would.
cool. I did not know that.
Yeah, so a baby could not breastfeed, they would obviously their life would be endangered. So
Sure.
this is not historically a new thing. I have had patients from other parts of the world, actually, maybe they were transferred here or whatever, and they're like, why is this so taboo here? Or, why is it so difficult to find someone to do this here? Because again, I think in cultures and societies where breastfeeding is considered the norm, we look at some problems that are part of that issue. We want to support breastfeeding, and so this is something that can get in the way of infant feeding in general, breastfeeding or not.
Sure.
um
If
I
the
do think
baby
the other.
can't, if the baby can't suck, if the
Right.
baby can't move their tongue properly, if they don't
Mhm.
have, if their jaw is not functioning properly, they're either going to be resistant because it's painful,
Yeah.
or they won't get the proper suction, and then they're not getting the nutrition.
Exactly. Yeah, babies are so smart. They are instinctual creatures. And, we look at a baby who is struggling at the breast, and we've oftentimes talked about a baby like that over the years in our culture as that baby just doesn't like breastfeeding, or that baby just doesn't want to breastfeed, or that's a lazy baby, or whatever people have said. But babies are here for survival. And so
Right.
they will oftentimes do things like go to sleep, and just stop nursing because they can't move the milk. And so they're going to conserve their calories.
Wow.
Or it's very, very painful to breastfeed them because they are not dumb, right? They're going to use other muscles to hang on. And that's where we oftentimes have these babies that have such tension in their faces and in their jaws, head, neck, shoulders. This is why we need a chiropractor for all of our babies, because of having this oral function problem. They're misusing other muscles, compensating.
Right.
So, which is part of what we all do, right? If something is broken
Sure.
or hurting on one side, we're going to compensate on the other. So we see this time and time again, and so often parents have been told that they should just stop breastfeeding, or they are unable to continue because it is just dysfunctional. So our job then is to help figure out what's going on and how we can support their feeding goals. And even, many babies struggle to bottle feed if they are tied. They can only breastfeed. Maybe they can manipulate the breast in a way that they can't with a bottle. So we help a lot of babies learn to bottle feed as well. So it's really just a oral function issue. We have an amazing speech language pathologist here that we are so thankful to have. She works with all ages and stages, but even through adulthood, when people are learning about their own oral dysfunction that they've had their whole lives, they can actually work towards getting that released as well here. So it's a really interesting thing. I think the big thing that we are seeing, we're seeing more of this because of education. I'll oftentimes talk about, we all knew somebody that had a speech impediment when they were a kid, and nowadays we know that they have speech pathologists. But back like when I was a kid, that really wasn't the norm. Plenty of children that struggled with that oral function issue, with speech, but there was no one really there to help them. So we weren't really catching it like we are now. So I just think we are looking, thankfully, more towards early education and early intervention. And so we're seeing things that maybe we just put a band-aid on for years before. And now we're actually looking at that root cause. Mhm.
Perspective of looking at nursing in other cultures and comparing it to the US, we are almost like backward in that aspect.
Extremely.
And it's I get so sad when a mom says to me that they're planning on not breastfeeding.
Mhm.
I'm a little heartened when they say I'm gonna pump, and then
Mhm.
because I'm like working or the family life is too nuts, but we're gonna pump, so that's great. But I think there's so much bonding that is missed in
Mhm.
those early stages. So how did we get here? What what happened?
Yeah. So there's a couple of, I guess it depends on who you talk to. Where did it start, right? But I absolutely believe that there's been a lot of breakdown in our country over the years with that bonding piece. So many of us have to go back to work outside of the home very, very early on postpartum. And yes, we do have protections in place legally to allow for us to pump at work, to breastfeed wherever your baby is legally allowed to be. You are legally allowed to breastfeed your baby. But obviously, having that return to work piece so soon is really difficult, and sustaining a supply with a pump is complex and
Yeah,
hard.
yeah,
Resources are a problem. We don't always have as many lactation resources, or there's misconceptions about whether that will be covered. Like our clinic we take almost every insurance company for our services. We take all of the Medicaid, state aid, insurance, and we try to get that word out so people understand there are resources available really to
yeah,
everyone. And so many other lactation groups do accept insurance as well. So I think that that's another part of why we've sort of gotten away from, uh, being able to help with breastfeeding. But if you go back far enough and you look at what the food industry has done,
mhm,
marketing to how we feed our nation, when formula companies first started, they were marketing to doctors' offices, nurses, and hospitals. And there's some really interesting, kind of like going back to the whole, Joe Camel was introduced by your doctor. Your doctor said that's the healthy one, right? And we
right,
can all laugh at that now, and it's just so ridiculous. But it
yes,
wasn't that long ago. And so, same thing with these formula companies. When they first really came hot and heavy on the market, they were absolutely no holds barred telling people this is healthier than your breast milk. Yep. They were telling people, your doctor says this is the right brand, and really setting up some really big misconceptions and barriers to women about breastfeeding, starting to teach through these marketing ads that women can't eat certain foods when they're breastfeeding. They can't drink any alcohol, or they can't have caffeine or chocolate. There's one poster that I'll never forget seeing. It was a picture of this woman in the 50s, and she's skinny and she has this beautiful dress on, and her hair is just perfect. And she's in this kitchen that is pristinely clean. And she's standing there with a glass of wine in one hand and a half eaten bar of chocolate in the other. And she kind of has her head like off to the side, like she's just having the time of her life. Now, in front of her is what I'm assuming is the father of her child, is sitting there in a kitchen. Okay, we're thinking back in the 50s,
uh-huh,
and he's feeding a baby a bottle. Maybe it was the 50s, 60s. So he's feeding a baby a bottle, and he's sweating. His tie is off to the side, and he's just like really working hard in this kitchen with the baby. And she is just sneaking behind him, having her wine and chocolate. And it was for formula. And it on the back in the background, you can see there's a bottle of like hot sauce, there's broccoli on the counter, there's coffee on the counter. So all of
oh,
the visuals of all of these things, they're saying you can't have these things when you're breastfeeding. Why on earth would you do it? Why would you do it? If you can have coffee or, wine and chocolate and your husband is going to feed the baby, forget about it.
Well,
But none of those
yeah.
things are based in any science. Yet we still, to this day, every single day, I have patients come in telling me, my doctor said my baby is gassy because I eat spicy food, or because I had coffee, or I'm so tired and I need a cup of coffee. Can I have a cup of course we want to talk about other ways, but there's those things are not backed in any science. Our breast milk is not made from the contents of our stomach. You don't have spicy breast milk, right? Like women in India or
Well, so
Mexico,
true.
yes, they don't stop eating the food of their culture because they're breastfeeding their babies. But these kinds of things worked very hard and very quickly to just degrade the way that we felt about breastfeeding, about this beautiful act between mother and child. Really also looking at the way we feel about women's bodies in our country, our culture. Do we trust women's bodies? Do we respect women's bodies? Do we understand that they are not just a business of having babies, right? That this is a natural process that our bodies are very capable of doing. And it's not to say that breastfeeding is so easy or that it's so natural that everyone should just know how to do it, because it is a learned process. And there are a lot of things that we need to be supporting moms with when it comes to breastfeeding. But how wonderful if we just had a culture that we showed each other how to do this, because it was just accepted as normal.
So fascinating. I talk about what you were just describing in my book, Stealth Health, how the food companies, the chemical companies, the media,
Yes.
the pharmaceutical companies, conventional medical model all work against us
Hmm.
to just make us sick and keep
Make
us
us
sick
sick.
our whole lives. And, you know, to me as a biologist, thinking you're going to swap a mother's breast milk with a man-made created liquid, like I don't even understand how anybody could track the parallel,
Yeah.
but yet they did,
Yeah.
and they sold it,
Right.
and
And you know, eh, your baby will survive with formula, and it's always a fine line that we're walking, because we aren't trying to demonize people for choosing formula.
right,
My concern is always, is that parent making that choice as an informed consent choice? What options are out there? If we do want to look towards an artificial baby milk, which is what we call it, it's artificial, right? If we are looking towards that, which is necessary sometimes, it just sometimes is, for lots of reasons, or even choice. But if we're looking at that as what we need to do or what we want to do, then why not look at all the options that are out there? And really, let's just take a quick deep dive on, turn the can around and look at the ingredients.
yeah, exactly,
If we do it for us, we should do it for our babies,
right,
you know?
right, right. So, what are some of the other options should that be necessary?
So actually, we this kind of started to get a little bit easier to get when we had our formula shortage. In the last couple of years,
Right,
there's been
that's right.
formula, yeah, and so more people were turning towards European formulas. And it was an interesting thing, because I would have patients saying, I got this at Target. Is this safe? Is this okay? It's from, the UK, or, it's a European formula. My pediatrician said it's not FDA regulated, so I shouldn't use it. And I'm like, uh, so are Fruit Loops.
Right, exactly.
So it was a really interesting conversation that a lot of people who maybe weren't used to looking at ingredient labels for themselves, because there is this inherent trust, and there should be, in what you are
There
able to feed yourself,
should be.
should be. Um, and the pediatricians were feeling, or certain providers were uncomfortable because it's new, right? It's not something that they've ever looked at before. So when we started educating about what's in this can versus what's in this can, well, you're not seeing the top high fructose corn syrup solids. You're not seeing, just hydrolyzed proteins, and I mean, words you can't say. And like, yeah, it's some of these things, let's break it down and let's look at what this is. But then the other piece to it is, in other countries, they don't allow certain types of food in their food systems, because they are actually looking to protect health, and wellness. So yeah, so it,
Right.
it was there's more European options out there. Of course, there's organic formulas. I do talk to people about, of course, looking at price point. Formula is incredibly expensive. So when we are looking at even like the cost of maybe coming to work with a lactation consultant, or working towards increasing milk supply, or whatever it is that we need to do, sometimes that's a cheaper option if we're just looking at cost, which of course is
Right.
a
For
big issue for
sure.
a lot of people. Yeah.
Mhm.
So, it's unfortunate that most of the kind of worst formulas are the ones that have all the coupons out there,
Oh,
or,
yeah.
you can get on sale or whatever. But regardless, they're very, very expensive.
Yeah.
So, yeah,
What
there's
what
goat milk
is
formulas,
Oh,
there's
goat milk. That's what
organic.
I was wondering about.
Mhm. Yeah.
Interesting.
So there are different options out there that, of course, I always talk to people about talking to their provider, their pediatrician, about these things. But at the same time, you know, always trusting your mom sense. And if that provider is giving their opinion on something, because it is an opinion when it comes to choices of formula, um, you have to make sure that that aligns with your parenting choices. So
Absolutely.
again, informed consent. Women are
Absolutely.
so good at making choices for their families. We've been doing it for eons, especially when it comes to feeding. And if you don't feel right about it, then you need to find somebody that's more aligned with you.
Yes, absolutely. And I talk about that in my book too, is that um, become your own best expert.
Yeah.
Understand yourself, do your own research,
Mhm.
and keep in mind that if a medical professional gives you an opinion about something they have zero training or expertise in, it is a personal opinion
Yes.
and not based on their any education.
Right.
So just keep that in mind.
Sure. Sure.
Yeah. So tell me, what are some common issues that you help moms and or dads and or babies with when they come to see you?
So, we, for all of our patients, have either 60 to 90-minute appointment times when it's an initial visit. So, there's a lot that goes into that discussion.
Right.
If it's a 60-minute visit, that's usually a baby who is having some kind of feeding dysfunction, who may not be breastfeeding. If it's a mom and baby, what we call a couplet, then that's a 90-minute visit as a initial evaluation. So in that time, we are talking, lots of crying, because it's
Right.
really, I mean, being a lactation consultant is so much more than just that functional piece. It's a lot of anatomy assessment and talking about birth trauma and just all of the things. Everyone has a story about breastfeeding or their bodies or their birth. And so unpacking that happens a lot, and that leads to a lot of discussion about what's happening with the baby. Um, Sleep related concerns, feeding related concerns, inability to breastfeed or inability to bottle feed. Um, Babies who are considered colicky oftentimes are just, what I'll say is, if their one job in life is messed up, which their main job is to eat, to
Mm-hmm.
sleep, and to poop,
Mm-hmm.
right? That's
Mm-hmm.
their job. And
Mm-hmm.
so if their biggest job is all messed up, they're going to tell you about it. They're really unhappy and they're tight. They're struggling. They're uncomfortable. They have lots of gas, oftentimes, lots of spitting up, reflux issues. There's so many symptoms that we go over. And when these babies start checking all these boxes, we're like, okay, probably know what's happening here. We've got some oral dysfunction. And then from there, we're going to do a functional feeding evaluation, whether that's breast or bottle feeding. We do an oral assessment, a sucking evaluation. We also have one of our nurse practitioners check if there are oral ties that we assess. we back that up with one of our nurse practitioners checking as well. So if, all of our care is managed personally, so it's going to be very individualized care. We recommend body work for every single one of our babies because the majority of them are struggling with tension, all over body tension. And when you learn about core muscle groups, like the tongue, one of the biggest muscles in
Right.
your face, responsible for so many things. When I learned about how it's connected to everything, actually through chiropractors that I've collaborated with over the years, I've learned so much about how this is attached to the bottom of my toes.
That's right. The
Everything.
myofascia. Mm-hmm.
Yes. So the tongue just fits right in there. And so when we have babies that have tongue ties or lip ties or oral ties in general, we so often see torticollis. We so often see a head shape that's, misshapen. They can only breastfeed on one side or the other. And, there's just so many of these things. So we highly recommend body work. Many of our patients are very afraid of chiropractic for their babies. It is something that I have tried to figure out for so long. I'm sure you have heard these things because there's some
Sure.
misconceptions about what's happening and if they're going to get their baby's head cracked or something,
I
swinging on a
know.
chandelier.
I
So
know. It is,
we
it
do.
is amazing. Like I can't even picture what they're thinking. And I tell people, okay, so when your baby gets adjusted, very often they sleep through it because I use what's called doorbell pressure, one
Mm,
finger, and I just press on the area that needs to be adjusted in a certain direction, in a certain way, with a certain torque, and that's what realigns them.
mm,
We don't do any popping or cracking or twisting, none
right,
of that. It's
right.
all very light touch.
Yeah,
Um, and yeah, and unfortunately, the whole medical profession thinks chiropractic is one thing. It's rack 'em,
yeah,
crack 'em. Meanwhile, there's dozens of different techniques, and the majority of them are low force.
sure.
So, and I do have a video on my website of a baby being adjusted, so people can see like it looks like watching paint dry because nothing's
Right.
happening,
It's
but a
scary.
lot's happening.
Yeah. It's
Yes,
so evident which babies have had that body worker, have had that body
really.
healer. So evident to the point that we've completely changed our practice a few years back, um, to where, of course, we can't force people to see a chiropractor, but though so many people were afraid to do it, that we started to collaborate with some PTs, chiro, cranial sacral therapy. None of us call ourselves these things, but we have a program that we get all of our babies started with, and it's movement. It's movement. It's gentle movement. And then if they start that body work and then they also see a chiropractor, it's such a difference in the babies that do have their procedure to release that tension on the floor of their mouth and on their lip and across their upper gum line. Those babies turn into noodles afterwards. Those babies feel the release of tension. It's something that it's hard to describe. I can just feel it when I'm holding them, and working with them either after the procedure or before and after. And then the ones who don't get that care, they're just still stiff and tight, which is why it's not all about just fixing the tongue tie. There's so many places out there now that are just fixing tongue ties and sending them on their way as if that's the thing that's going to fix everything. And it's a piece to the puzzle. It's an important piece to the puzzle for many people. But that before and after care that we really work on is, and we again collaborating with people in the area, that's a huge part of our success with our patients.
Holistic realm that use each other
Yeah.
because not only are people more and more and more messed up at an earlier and earlier age,
Hmm.
it when you get into the holistic realm, you realize, well, for me anyway, I have 3 or 4 chiropractors. I have
Hmm.
2 or 3 massage therapists. I've got 2 cranial sacral therapists because they all bring different things to the table for me.
Yeah.
And it helps to have this whole arsenal of people.
Hmm.
So for me, when I'm at my office with my patients, I can only like help in this realm. When we
Yeah.
go outside of that, okay, I know about that and I know where to send you. So this is
Hmm.
this is what we'll do.
Yeah,
So
that's
that
huge.
I appreciate all your referrals to me. And the moms, I have to tell you, the moms and dads that bring the babies in are so gung ho about it.
Mm.
And they recognize the gravity of what we're doing, which is makes our job so much easier.
Sure.
Um,
Yeah.
because the babies show up, they get the work done. I can reflect back like, oh, I'm noticing this, and they can say, I thought so. I thought they were
Hmm.
turning their head better, or not so crooked, or more relaxed, or something like that.
Yeah.
Um, yeah, that's super cool. It makes me think that you and I need to collaborate even more. Like when I do see an infant that's not seen you, I just need to send them over there, just so you can evaluate them because
Yeah.
it's
Well,
such an
we
important piece. This whole lip tie, tongue tie thing.
Yeah, and I oftentimes tell people, so it's myself and my business partner Raquel. She's another one of the lactation consultants here. I've learned so much from her over the years. And my other business, there's three of us. My
Hmm.
other business partner is Crystal. She's one of the nurse practitioners here as well. And I've just we just love working together because we learn all the time from each other, and we know we're so lucky to not be in a silo. And then through collaborating with people in the area, it's just broadened our practice so much. And so I'll tell people all the time, we pretty much all speak the same way here. We're very aligned in how we talk. But I love hearing the perspective of someone else, even that pediatrician who says, no, this is not a thing. This is not real. It's your baby's fine. And I'm not afraid of that because, we really need to look at every data piece and every perspective. And you have to feel comfortable as a parent with what it is that you're choosing to do. And it's not what I say to do. Right. So even if you're just being evaluated and you have the gift of knowledge about what is happening in front of you. None of us care what you do after that. I mean, we care, but we don't, it's not going to make me mad at you if you don't get your kids' times fixed, because you just get to know. And you felt like it was the right thing to do to go a different route. And that's okay. I'm going to be here to support that too. And so, even if it's a patient that feels nervous about like coming to a place like this and being evaluated for ties, it's just an evaluation. And we're so very laid back here. I mean, it's not anything that people need to feel forced one way or the other into, because we're our whole being is about giving you the ability to make your choice, not about making anyone feel pressured into something. Exactly. Exactly. Hmm. Hmm. Go from there. Yeah. Yeah.
So I have one last question for you, and I did not preview this to you. I'm sorry, Katie.
That's okay.
If you had a billboard for all to see, what would it say?
Hmm. Well, I I guess I feel most um I feel the best when a patient comes here and says that they finally feel heard, that they've been dismissed, they've been undermined, they've been disrespected, and they finally come here and they feel heard. And that's not just MomSense. MomSense is also we have Optimum Women's Health, and we have Just You Medical Aesthetics, where we do skin health as well. So in all of I mean, it's a MomSense kind of umbrella. So if there's a billboard, right, it's going to be our three sisters. And it's just, we are a place that wants people to feel heard and seen and lifted up. And so if there's a slogan or a billboard or one thing that somebody could feel about what it is that we do here and how we practice, it would be that, to feel seen, to feel heard, and to be respected.
I love it. I love it. That's super cool. Thank you so much for teaching me all of this stuff because it was
Thank
a lot of
you.
it was new to me and yeah, I appreciate all the great work that you do with all of our babies. Really
Thank you
do.
so much. We appreciate you. We need people like you. So I'm so thankful when I have a patient that I know is going to be, we're always trying to, where do you live and who could you see and all of that. And, we're going to trying to match people all the time and you're just an easy match. So
Very cool. Thank you for the
yeah,
compliment. Well,
thank
for
you.
our audience, this has been your Healthcare Arsenal with Dr. Nancy Trimbley and Katie Beeson. And as I said previously, with each passing episode, I hope you get closer to being your own best expert. Bye for now.